Now to another public health threat, monkeypox. Health officials have identified nearly 3,500 cases here in the U.S. Remember, the first case here in the U.S. was discovered just 2 months ago. We're learning the White House is now expected to name a coordinator to oversee the administration's response, a response that even Dr. Anthony Fauci says needs to improve.
There now has to be a balance between vaccines available for those who clearly have been exposed, as well as those at risk. And that's where the change in the distribution so that you anticipate that someone might get infected as opposed to responding to someone who is infected.
Dr. Fauci also mentioned a public health emergency declaration for monkeypox is under active consideration. Kyle Plank is recovering from monkeypox. He started feeling sick in June, was diagnosed in early July, and he's joining us now. Kyle, it's good to have you here. Thank you for coming in.
Thanks so much for having me.
You're fully recovered now, right?
I am, yes, thankfully.
Any residual issues?
Not really. I mean, I have a little bit of scar tissue where some of the lesions were, but that's slowly going away over time, and I'm hopeful that it'll get better in no time.
Tell us how you learned you had monkeypox.
Yeah, so I actually work in the infectious diseases space. I'm a PhD candidate doing research. So with that and being a gay man in New York City, I feel like monkeypox was on my mind a little bit more than your average person, perhaps. So I was aware that it was happening in Europe, and after Pride, when I started to feel sick, I came down with some symptoms, some generic flu-like symptoms, and I was worried that I had COVID. But in the back of my mind, I was like, perhaps this is something else, perhaps this is monkeypox. And then a few days later was when the spots started to appear all over my body. And
I know we have some pictures of these spots. Can you describe a little bit more how they differ from other rashes, other blisters?
Yeah, so the progression moved really quickly. So they looked almost like pimples when they first appeared, and then they turned into what they call pustules pretty much by the end of the first day. They started in my arms and my hands, but they spread all over my trunk and my legs at that point. And I also had some internal lesions on my mucous membranes that were super, super painful.
Yeah, it sounds so painful. How would you describe that? Because you have said it was like the most pain you've ever experienced.
It was. It definitely was. For about a week, I had extremely severe pain. It was like a burning sort of pain that just wouldn't go away, even with alternating different types of painkillers. And that pain really didn't abate until I got prescribed tecovirimat, which is an antiviral used for monkeypox.
Okay, so once you got prescribed that, what did the treatment entail?
Yeah, so it's a 14-day course of pills that you take twice a day. You have to take it with a fatty meal to help with the absorption. But basically, within 2 days of getting the treatment, I started to feel better, and about half of my lesions actually started to disappear back into my skin, rather than progressing to the scabs like monkeypox normally does. But getting the drug was a complicated process that a lot of people are not able to do, unfortunately.
And so that brings me to the letters and the outreach that you have done to officials trying to say, hey, more people need to have access to this drug, TPOXX. More people need to know about it. Have you received any response? And who exactly did you reach out to?
Yeah, so I cast a wide net for sure. I was reaching out to our senators and representatives here from New York, but I also wrote letters to HHS and CDC, just trying to reach the people in charge in charge of the TPOXX response, basically. And I was just hoping to change the procedure that's required for getting access to TPOXX.
Was it difficult to get access?
Definitely. So you have to have a high suspicion or a positive monkeypox test in order to get it, and it requires hours and hours of paperwork for the doctors actually to get it from the national stockpile. So for people who aren't connected to academic medical centers like me, it's really, really difficult to get this, even if you're in severe pain.
So what more do you think the administration could do? As we discussed, at the top of this segment, that even Dr. Fauci is saying more needs to be done. There's talk of a monkeypox response coordinator being named.
Yeah, so I think it's kind of like a tripartite strategy of increasing vaccinations to prevent the disease, increasing access to treatment for people who are sick so that they don't spread it any further and they get better sooner, and then information as well, which I think CDC has been working on an information campaign, but it definitely has not been effective as we would hope. So thankfully last Friday, they actually made it a little bit easier to get TPOXX. All of the requirements to enroll in the EA-IND protocol, such as like taking pictures of your lesions, getting blood work done, all of that was made optional. But I think our next steps are having a full-scale clinical trial of the efficacy of this drug and making that optional and not required to get access to the drug, because that's really what creates a barrier for a lot of people, is having to have their doctors have the knowledge of how to enroll them in this trial in order to get access.
Do you feel like the administration has a handle on this at this point?
I think the wheels are definitely in motion, but unfortunately, too late. I think the outbreak can still be contained, but I think it'll take really dramatic action on the part of federal authorities helping to get vaccines and treatments out to people really quickly. Because I think there was a window back in May and early June to control it that we missed, and now it's a lot larger of a problem than we would hope. So we need to take some pretty bold action to get it under control.
Kyle Plang, thank you for sharing your story. Thanks for sharing all of that great knowledge that you have of this virus with us. I really appreciate it.
No problem.
Wish you the best.
Thanks.